morning. Welcome to City and State's latest state legislative forum, this one on the biggest issues affecting Rochester. I'm Zach Williams, state politics reporter at City and State. I'm super excited for this event. The Rochester area, and we're going to use that term loosely to include all the Finger Lakes, rural, suburban, urban out there. It's just been such a big year for the area. Obviously the pandemic, protests, and a slate of new legislators entering Albany, many of whom are right here today. Lucky us. So a couple of things, just again, keep in mind the loose definition of Rochester we're going to be using to help people like me who live in Albany who just don't know the local layout nearly well enough. And secondly, we're going to do our best to leave plenty of time for questions. Just drop them in that Q&A box, which should be at the bottom of your screen. Sometimes it's in the upper right. But just put it there and we'll try to get it into the conversation. Super packed panel here, but unfortunately we might not get Assemblymember Meeks' duty calls, and there's a power outage with his constituents and he's got to take care of that, but maybe, just maybe, we'll be lucky enough to see him towards the end. Now I'm going to introduce all of our great lawmakers here and our other panelists. Just give a wave when you can, when I say your name. First up, we got State Senator Jeremy Cooney from the 56th District. We got Senator Edward Rath III from the 61st District. Assemblymember Marjorie Byrnes from District 133. Assemblymember Sarah Clark from District 136. Assemblymember Jen Lunsford from District 135. Hopefully, again, Assemblymember Meeks will join us. He's from District 137. And then batting cleanup is the great Bill Ferris, Senior Legislative Representative for AARP New York. And let's jump right into it. I'm going to pick on Bill first, actually. Huge year. We just had the state budget come out, packed with all sorts of stuff. Maybe you could just give us a little bit of the layout of the land, what got passed, what doesn't, and how does that relate to what's going on in the Rochester area?
Well, from AARP's perspective, it was a very good budget year. There was a lot done with nursing home reform, which I think everybody knows was a problem in the state of New York, which much needed reform, and to make sure nursing homes spend a majority of their care on the residents and make sure that the nursing homes are following the law and pushing forth the best care for their residents. But I think the one issue that really crosses both the rural setting and an urban setting that was passed in the budget is two issues dealing with the internet. One was a mapping provision that the Public Service Commission would map the whole state of where broadband exists, also look at the affordability of broadband across the state, as well as the download and upload speeds of the internet in various areas. And I think during the pandemic, I believe everybody on the line today can understand the importance of the internet, understand being at home and having high-speed internet access, not only to conduct business, but also to communicate with friends and family. And the other issue is that I believe everybody voted on it on the line today as well, as to make the internet more affordable. So we're going to map where it exists, doesn't exist, and then actually make it more affordable for people to access the internet. And both provisions were very good. AARP was very happy, with those provisions. It really deals with isolation with seniors and the ability to communicate. And so I think it's an issue to start the discussion of how the Monroe County area and the Finger Lakes area both has urban centers as well as rural areas, in which I believe we're going to talk about today. So, and there's 100 other things in the budget we're very positive that I can't get to now, right, Zach?
Yeah, broadband is one of those issues that was really highlighted by the pandemic and really seems at the heart of the national discussion on what is infrastructure. Kind of throwing it out, what are similar issues that, were kind of simmering for years and years? Broadband access certainly has been an issue for years, but what are some other issues that similarly have affected seniors that have really gotten some attention, but maybe not enough thus far? Who wants to jump in on that one?
Well, I'll jump in again. I think an issue of long-term care, and I know we're going to discuss this. There was, and I can tell you from AARP's perspective, we've been lobbying for years to really have a shift in our long-term care system, to have more resources and more efforts put to keep people at home and living in their communities. And there was additional money in the state budget to do that. mainly through the programs that are offered through the State Office for Aging. And, there has not been a survey, at least in my experience with AARP, when we ask our membership, how do you want to receive your long-term care services, and where do you want them, and who do you want them to deliver? And the numbers are off the charts. They want to stay at home, and they want the caregivers, usually family members, to help them stay at home. There was an initial investment this year, but not to put all the legislators on the line, but in the future, we're really hoping for more resources and a closer look at how we care for our elder citizens, members of our society at home. So I'll just throw that out for discussion, Zach.
Yeah,
right.
I'd struggled to get my mute off, but I was going to discuss the nursing home issue. It's unfortunate that it took such an enormous tragedy to finally get us to take the action we needed to overhaul our nursing home system. And I'm really proud of the work that we were able to get done. We really made enormous strides. There's obviously some more to do, but the cost ratio, I think, is going to go a long way towards ensuring that our nursing homes are putting the necessary funding that we need towards direct patient care. I'm glad that we're finally getting a handle on the for-profit nursing home system. And I know some of my colleagues on this call will disagree, but I was an attorney for 10 years and I dealt with many cases involving nursing homes, nursing home fraud and abuse, nursing home neglect, and med mal. And I can tell you that the for-profit nursing homes were overwhelmingly the greatest offenders. And I think that when you put a bottom line on human services, it disincentivizes direct patient care. So I'm really glad that we were able to get a handle on that issue.
And I was also going to add that if you think about what wasn't necessarily a senior issue that got done in the budget, but will affect a lot of them, is rent relief. The enormous amount of money that will go to help those who can't afford to pay rent will help a lot of our seniors who are living at home, but also those who are small landlords that make their income today off renting apartments or maybe have a double or have used that as their way to help them offset costs of retirement. So the rent relief bill will both help both sides of that and be a real economic relief for some of our seniors who are suffering from that.
Bill, I'd like to chime in actually on the first two issues and going back to rural broadband just for a moment, as well as broadband access. This is critically important, and there are broadband deserts all across New York State, urban, suburban, rural, and agricultural. And we heard about it, all of us, as candidates and as elected officials, of the importance of digital access for our children, for those of us who work out of our homes, as well as people who are in our senior facilities. And we need to provide the money, the resources, the affordability, and the connectivity. It is for sure an infrastructure investment. And just one statistic, 25% of our children across New York State don't have broadband access. And that cuts across not just our children who are struggling, but also our seniors. And when it comes to long-term care, you brought up a point which I think is very important, which is allowing our seniors to have the flexibility to age in place if they want to in their homes. And many, many seniors want to have the capacity to age in place. It's really important that we provide the resources, if it is their family members who are going to be the care providers, or to have government or private sector organizations provide those aging in place services to our seniors, because many want to stay in their homes. They've been there for decades. There's a way in which we can make this work, and with the proper allocation of resources, aging in place can expand and continue to thrive and prosper for our seniors.
I'd like to jump in for just a second. Thank you, Marge Byrnes. On the broadband issue as well, joining with the Senator Rath. We have so many assemblymen and senators, I should be specific. But in any event, in my area, we do have a lot of spots, including in Monroe County, that do not have access to reliable broadband. And, while I absolutely agree that it was important to have affordable broadband, I think before we give that much in the direction of affordability, we need to look at accessibility. So many people contact me, and it has clearly become in the last year imperative that everybody, no matter where they live, has access to this, be they older people through AARP who want to make sure that they can have communications with their children and their grandchildren, people who need to work from home, students going to school. And like I said, there are so many areas that don't have access, that even though we have passed a budget bill that will indicate that a lot of people, especially who are indigent and qualifying for free lunches in school, should be able to have affordable $15 a month broadband service. That doesn't help much when they have no connection to their house, because the bill does nothing to connect people who are not already connected. And as a result, these people are losing out again in small providers. I think it's 20,000 or less. All of a sudden, they're exempt from this. So in the rural poor areas, I believe that we're going to see a lot of people that are totally left behind, even worse than they are now. On the nursing homes, I myself filed a complaint with the Attorney General's office against a for-profit nursing home in my district, because I was very concerned, obviously, about things that were going on last year. But most of the nursing homes in my district are for-profit nursing homes, and they have waiting lists. People want to be there. So I do have concerns that some of the legislation and the budget bills that have been passed are going to actually make it far more difficult for for-profit nursing homes to continue operating in our state. And some of the bills specifically indicate that that's what they're looking to do away with, any for-profit places. And some of these places are exceedingly good. And to do a wholesale bills designed to eliminate an entire industry that some people in my area have no option and want to go to, I think is problematic in the long run.
Zach, if I could jump in here and follow up on the Assemblywoman's point, I think it's a good one in terms of the communication. I think, Bill, you mentioned, what are some of the sticky issues here that have been hanging around. All of these issues when it comes to our aging population are somewhat related, right? It's kind of this interweb of connectivity. As people are aging in place longer, they're staying in their homes. And that gets to what Assemblywoman Clark was talking about with rental assistance. And as the senator shared about broadband access, making sure people are able to be connected to the greater environment. But one of those sticky issues that has been around for a long period of time is an increase in elder abuse, both from a caretaking standpoint, but also from predatory calls and predatory outreach. Especially, we saw an increase in that outreach during the pandemic, where a number of our seniors who are isolated in place or staying at home safe, just as we told them to do as government leaders, to quarantine, were then subject to phone calls looking to take money, sell services that weren't necessary, give access to the vaccine early on, when that was, of course, it's a free process, but they were being charged. And so one of the things I'm really proud to support with many of the folks here on this call or on this Zoom today is the support for the Elder Abuse Prevention Program. That's really a statewide program, although proudly within my district in Rochester with the great Lifespan. And I see Anne-Marie Cook is in our chat here, the CEO of Lifespan. But this is a program that really is administered statewide. So whether you're in New York City or Long Island, or whether you're in upstate, we know that seniors are vulnerable, and we put the resources to the tune of hundreds of thousands of dollars in the budget so that we could have the resources from a legal standpoint, a forensic accounting standpoint, to make sure that seniors were given the right information and were able to get their resources back if they had been scammed in some way.
Hey, Zach, I just want to follow up with the senator. We could not agree with you more, Senator, about elder abuse, and actually Lifespan, and I know Anne-Marie Cook's on the line, as you said, they really have been a leader in the state of New York for looking at elder abuse. They've issued reports. In our opinion, they're one of the best in the business on looking at elder abuse, and they are located right there in Rochester. So we've always been supportive of money for, resources in the budget for lifespan to continue that really good work on elder abuse. And if you look at the stats across New York, across the country, there are hundreds of thousands to millions of dollars lost on scams to seniors. And it is tragic. And, just to say we're glad that there was an investment made in this budget to make sure that doesn't happen.
Along those lines, I would like to bring up our first question from the audience, which kind of gets to the same heart of exploitation of older folks, medical debt. Certainly older people aren't the only people that face big hospital bills and insurance and all that, but I would wager that they probably get the worst of it than most people. And there's something called the Patient Medical Debt Protection Act, S2521A, for those who are curious. I just throw it out there. What do you folks think about this bill, and what are the chances for maybe passing it this year?
It's a bill that AARP supports, and any type of debt we've seen is very difficult for people. Of course, they should pay. If they owe something, they should pay it back. But that bill takes a very close look at medical debt of people struggling with their medical bills, struggling to repay them. We think it's a good first step to look at that.
And, correct me if I'm wrong, this is one of many issues that also highlight racial divisions among seniors, right? I mean, this audience member kind of pointed out that people of color in Monroe County are, and I don't know if this is the accuracy of this number, but they say are 3 times more likely to have medical debt than white seniors. So, again, is there any, are legislators talking about this issue? Is there any chance on doing something about this anytime soon?
Zach, if I could chime in real quickly. I'm sorry, go ahead, Sarah.
Oh, no, I was just going to say, this highlights the longer problem, right, of a healthcare system that does not work. I think we understand very much so the prescription drugs. We, my previous life as a Senate staffer, worked for a senator who was on the U.S. Senate Aging Committee, and prescription drugs were the #1 problem our seniors were facing and the cause of so much debt, to the point of hearing some of the most really troubling and emotional stories of people who literally chose to not to have their spouse take life-saving drugs and pass it, instead of raiding their retirement funds and having no money left over at the end. So there's a larger problem here of fixing the healthcare system, because with the costs that our system is, people should not be in debt and not be declaring bankruptcy and not having these huge medical bills coming to their house. The disparities are real too, though, along racial lines, and for those who can least afford it tend to have the most highest debt, which is really backwards. So there's a lot to fix, including that no one should be sort of burdened by these bills that are huge, but also the bigger problem of fixing the healthcare system so that no one has to face this ever again.
So on this bill, this is actually a Senate bill sponsored by Senator Gustavo Rivera, who is the chairman of the Health Committee. And Jeremy, I'm looking right at you, and we all know that Gustavo is a very loud and a ferocious advocate for issues that are health related when it comes to the Health Committee. And I serve on the Health Committee. So I look forward to talking with him and working with him on this issue, because when it comes to medical debt, we do have a responsibility to our seniors. We have a responsibility to make sure that the incredible costs that they are enduring, if it's prescription drugs, if it's healthcare costs, if it's just trying to make ends meet. And my mother lives in a continuing care facility in Amherst, and she's been there for several years, and it has been very challenging for her to transfer out of her home into continuing care. So I hear every single day what her perspective is, and she's got a pretty strong perspective when it comes to government and healthcare and nursing homes and all the rest. But my point about this bill is it has my attention. As a member of the Health Committee, I will be paying very, very close attention to it. It has my prioritization, and with Senator Rivera across the top of it, certainly all of us on the Health Committee are going to be dialed right in on this one, that's for sure.
I agree.
And I would agree with my colleague, Senator Rath. Certainly, if Senator Rivera has got it on his radar screen, it will be on all of our radar screen very soon. That said, I think it's worth noting again the point, though, that as our aging population continues to age and staying at home longer, there's going to be increased costs to that care. And so whether it's in a skilled nursing facility or one of our long-term care facilities, or whether it's at-home services through home health aides and the medical equipment required for that, with intermittent hospital visitations or doctor's visits, this is just going to continue to be an issue. And so in many ways, it's a blessing and wonderful that our technology has allowed us to live longer, more vibrant lives. In other ways, it costs us more money. And so we need to figure that out and find a way that we can create environments where our seniors can live lives of dignity and respect, especially as they become less and less mobile. But at the same time, we can't allow that debt to then be passed down generationally to subsequent, either children or grandchildren who are having to take care of their loved ones. So it's something that we'll definitely take a look at as well.
Along similar lines, the budget did include a huge rent relief fund. I imagine there's plenty of seniors out there who need rent relief. But as we were mentioning, older folks aren't always the most technologically familiar folks. Many of them lack broadband. What needs to be done to ensure that seniors get the support they need to actually go through all the paperwork and actually get some form of housing relief?
I can take that one. So I think that it's very important. And as we were conferencing that particular issue, that was something I kept bringing up, was that not even just our seniors, but many tenants, particularly those with income that comes from public benefits, it's hard to substantiate that that income. As a lawyer, I had people come to me all the time looking for award letters and things. So one of the things that we did that I'm really appreciative of is we have a $100 million fund that allows landlords to apply for rent relief on behalf of their tenants who are struggling. And that gives those tenants the opportunity to receive that relief, but puts the onus on the landlord to make that application. And I've been in contact with the Office of Temporary Disability Assistance. As soon as that rolls out, we plan to have an online forum to help people figure out how to use that application. And I imagine all of our offices will be getting a lot of questions from people, but I'm on the library committee and I'm talking with our libraries right now. I know a lot of people may not know our libraries are helping people sign up for vaccines. They're helping people apply for unemployment. And I hope that we can leverage our libraries also to help our seniors and other kinds of tenants apply for this benefit.
I agree with Assemblymember Lunsford that rent relief is important for the elderly. The flip side, though, is I've had a lot of phone calls also from elderly people who are landlords, small landlords. They may own one house or one small building, and they relied on that income to supplement their Social Security. And because of the pandemic and the rules that were put in place against landlords being able to do evictions, totally understand why. But what the back end was, it made it so some of these elderly small landlords were unable to pay their bills. And so I think it's equally as important that we look at the entire span of the issue and look at not only at landlord relief in conjunction with tenant relief to make sure that all of these individuals are taken care of. And, I just don't want our elderly landlords, especially the ones who've reached out to me and relied on that money, their rental money, in order to get by themselves. Because you were mentioning before about how, without monies, you can't pay for your own prescription drugs. You can't pay your own bills and taxes that we need as a society to keep our government running, even our local communities. So just putting a pitch in there that we need to look at all of the parties that are concerned.
And I would also add that one of the things I advocated for at the beginning of the year was more money to remove our lower income seniors from the wait lists that give them critical services, whether it's food access, but it also involves case managers that will help them get through processes to get the things that they need, like rent relief and legal services or anything else that they may need. So for the first time ever, we know there's about $27 million needed to remove every senior off a wait list. We got an extra $8 million this year. which is a huge increase that it has never seen in a very, very long time. But that really aims at getting these critical services and these critical relief programs to our seniors. It helps them sort of navigate that whole process so that we are making sure that they're protected and getting what this critical relief that we've passed through.
An important aspect of this also is the federal rental assistance program and the money that has been held up for a long time for relief for landlords. And it's been mentioned a couple of times, but it needs to be reiterated that this is millions and millions of dollars to support our small, medium, and large property owners. And they are struggling like there is no explanation for how hard it is for them to make ends meet. So we certainly have to provide tenant relief. We also have to provide landlord relief, and this certainly affects seniors. This is, I think, a equation that where both sides of it are connected. And if we can release that federal rental assistance money, it's certainly going to help out the small and medium-sized residential property owners who right now really cannot make ends meet and are really at wit's end. We've all heard about it. We need to continue to fight for that money to be finally unfrozen.
Yeah,
Senator,
the state has in its possession money from the federal government specifically designed for small landlords and small landlord relief. And there's absolutely no reason why our state government and the executive has not released those funds to help these people out.
I was going to ask who of all people would hold this money up? Obviously, the governor is the governor, but any idea what the stated reasons are for holding up this money, or any timetable on when it might happen?
There have been no timetables on releasing it, but what I do know is I believe, and Senator Rath can correct me if I'm wrong, I believe that if the money that is sitting, we literally have the money as a state for this purpose from the federal government, but that if it is not used by, I believe there's a date in September, that the federal government can come take that money back and none of our landlords will get the relief. So it has to be used or it will be lost.
That's 100% accurate. And this is money that is just lying right now, unutilized and unallocated. And we have a responsibility, I believe, to allocate those resources as soon as possible for our landlords. We also have that same responsibility for the tenants. It needs to be relief for the tenants. We all agree on that. And if this money is clawed back, shame on New York State. That's the last thing we should be doing, is pushing that money back to the federal government. It's earmarked for a specific purpose. Us as elected officials need to put the pressure on the governor and his administration to make sure this money is allocated. I'm hearing from many, many property owners. I'm sure the rest of the members in the State House are also as well. Let's push for this. We had a press conference fighting for this several weeks ago, and we're going to continue to fight, because once the money's there, let's spend it, folks. Let's not leave it sitting around in Albany, per se.
Yeah.
It's probably worth just noting, again, that the interconnectivity of these issues, right? So we have to recognize the role that long-term healthcare facilities, whether you're a skilled nursing home or whether you're an enriched living or assisted living facility, plays in the care of our aging population. And so we know that there's a limited number of rentals available, or folks who perhaps are in an unsafe condition within their rental, right? Because they probably shouldn't be living at home because they maybe not have some accessibility issues. But it ties together the need for proper housing for our aging population, appropriate housing. And again, ties back into the medical debt issue we just spoke about before, because a lot of our seniors can't afford to go into a for-profit or not-for-profit skilled care or nursing care facility because of the high cost as it. So it's a really complex issue. And I would agree that the resources that we have available need to be allocated fully. And I believe that in the budget, we put a lot of resources in rental relief so that our landlords can work with their tenant, whether they're seniors or not, to make sure that they can have stability as we come out of this, God willing, come out of this COVID pandemic.
That's a perfect segue, Senator, to kind of a broader discussion I wanted to bring in here. Before the pandemic happened, I would say Rochester was kind of up and coming. In upstate to some degree, more broadly speaking, housing is a big part of that. If I remember right, Senator, you're one of those millennials who now lives in downtown Rochester, where cafes and everything are hopefully reopening. Yeah, look at that. Look at that room behind him. So I'm just kind of curious. We got billions of dollars of federal money, big state budget. Seems like there's a lot of money being thrown around that could help Rochester and the Finger Lakes region as a whole. Get set up for the future. Any thoughts on, how we can do this to make housing, for example, more affordable for an aging population?
Well, one thought is that we have to stop looking in silos, right? And so, that housing cannot just be, okay, this is our senior housing over here, this is our low income housing over here. We have to start looking at integration the same way we look at economic development. And I'm all about jobs. And so we talk about rebuilding our downtown, which I represent in the Senate district. And so when we talk about downtown development, we often talk about mixed use, right? Commercial usually on the first floor, some sort of housing or office environment above, right? The same thing could be happening for how we look at affordable housing programs and projects, right? Is that it shouldn't be targeted to, this is just a senior affordable housing program. And a good example of that, I would say, is actually in my colleague, Assemblywoman Lunsford's district out in Penfield, with what the YMCA of Greater Rochester is doing right next to our East Side YMCA. Episcopal Senior Life and the YMCA coming together to create a housing environment for active older adults who want to be in the community in a safe space, but also want to have the community and the assets and the health and wellness aspects of the YMCA program. And so that's a really good example of how housing can be used to meet a community need and create the physical and mental. Look, I think that's really important when we talk about our aging population and housing, is that mental, social interaction that so many of our aging population feel isolated, and they want that community feeling. And so can we design housing and neighborhoods and settings to facilitate that type of interaction? And I think that's a perfect place for Rochester. I would push back on you a little bit, Zach, and say we are still a great up and coming, and we are still there. There was a list I saw our former Lieutenant Governor tweeted out yesterday that one of these surveys that said Rochester was the best place in upstate New York post-pandemic. I said I think we were the best place in upstate New York pre-pandemic. But again, as we look to rebuild our upstate cities, is there a role for us creating housing environments and programs and projects that are inclusive and more inclusive than they have been in the past?
And I also think on the affordable side, we have to have a real reckoning around what is affordable for housing. The pandemic, I think, has just thrown a real estate market that always had its ups and downs into a complete, I don't even know what's going on. I mean, we've been struggling to find a 2-bedroom apartment for a family under $1,400 a month, which in Rochester just seems unheard of right now, that there is literally no apartment available for that family that they could afford. So when we talk about seniors, when we talk about all these mixed use, I mean, I do love the idea of sort of having our housing that we sort of invest in into the future be a little bit more mixed use and having different ways of doing it. Although if seniors are going to age in place, which many, many, many more of them want to do, we have to keep in mind of what kind of housing that looks like. It's usually one floor. It's usually got some ability to, communicate with a central office or do something to protect people when they may need something in an emergency. But affordable is really the key. I mean, if housing's not affordable, we're going to continue to have these problems. So if we keep people out of congregate and long-term care settings, can we reinvest that money to make sure the housing is really affordable? And we have to look at how we pay home health care aides, which is really, really how the people that care, I always say, the people that care for our parents and the people that care for our children should be the most important. And we really need to value their work and look at their wages.
Yeah, I feel like okay.
I just wanted to mention a bill that dealing with housing. It's a Senate Bill 4547 by Senator Harcum and 4854 by Assemblyman Epstein. And it looks at accessible dwelling units, which is both an issue for, an urban area and certainly in the suburbs. And what it basically says is to have our housing agency, DHCR, set out a framework in which municipalities and towns can come up with regulations to allow people to have accessory dwelling units on their property. And in what we've seen across the country is many times a lot of older persons reside in those. And we were talking about, having older people living with younger people. This is a perfect example of, letting localities figure out with general guidelines from the state how to do this. And AARP is a 50+ organization. This helps our younger members keep their older parents living with them literally on the same property or very close to them. And it's just one of these things that that has popped up in the legislature. AARP thinks it's a great idea, and we're hoping it will be pushed forward this year. And as I said, the state of California has it. So if the state of California can do it, we can certainly do it.
Yeah, I did want to just comment a little bit on kind of the intersectionality of this issue, both in terms of, I saw some people in the chat mentioning people with disabilities, people with kind of profound disabilities who had always been raised by their parents. As their parents pass or become unable to care for them, we have a population of people that are really struggling with housing because they can't afford long-term care facilities. So we really need to consider how we help our aging disabled population and also our LGBTQ population, who are more likely to have less family support as they age. And I think that, Jeremy talked a little bit, Senator Cooney, about siloing these issues in terms of housing, but also siloing these issues in terms of population as well. This is a really complex problem. And we have an affordable housing complex in my district that has recently raised their income requirement just slightly above what qualifies you for Section 8. So we have kind of these warring issues as they relate to qualifying for public benefits, and I think we need to find a way to address that.
Two things I wanted to just bring up is I think both of you were touching upon some that I always try to keep in mind when we talk about seniors, which is seniors are a diverse group. There's a lot of difference between someone who's 65 and someone who's 97 for so many different reasons. So I did want to acknowledge that. Secondly, we've been talking about urban housing, suburban housing. What's going on with rural housing on some of these points? Senator Rath, you might know a thing or two about rural constituents. What
Sure.
sort of housing?
Absolutely. Thank you for the question, Zach. And my district spans from the city of Rochester, traveling westward all the way across to the town of Amherst. So I have a ton of urban and rural communities I represent. Even in Monroe County, portions of Chili as well as Raga certainly are rural. And there is a desire for there to be access to housing in these rural communities. And some of them are growing and expanding in reasonable ways, like our urban areas are growing and expanding. And there's a real destination for a lot of people to live in these agricultural and rural communities. I like the idea of empowering our municipalities, our towns, and our villages with housing strategy and housing policies and programs and procedures for how to make affordable housing available and how to basically define the local rules. I am very concerned and always very suspicious of a statewide top-down unilateral approach, because what's right for upstate and the Finger Lakes region is very different than what's right for the Hudson Valley or the Mohawk Valley or Long Island. So when it comes to access for housing in our rural communities, I look forward to partnering with my towns and my villages to make sure that accessibility is there, resources are available for reconstruction, adaptive reuse, repurposing of buildings. Because as I travel this district and I go into those rural communities, I'll tell you, it's pretty darn attractive. And I know a lot of people would be interested in living out there. It also ties in with rural broadband. You want to bring it full circle? I mean, they want to live in these towns, but they also want to have access to the internet and access to services that they can. So let's leave it to our towns and our villages to make this work. And I know that we can, partnering with our local leaders.
I agree with the senator, Senator Rath. Also, though, a component of this that can't be overlooked when you do move into the more rural areas, is the lack of transportation. So that if people don't have their own vehicles And many of our areas do not have any type of bus transportation, other than maybe 1 or 2 runs into villages and then down to more municipal areas for shopping. But, most of our roads have no buses. And if you're unable to own or afford your own car, it is a serious detriment to living in a rural area, no matter how beautiful it is. So that would have to be, though, another factor that was considered as you're looking into it. And some of our rural areas also aren't on sewers. So when you start looking at having large complexes, it becomes problematic if they're on septic. And those are just some of the issues. But as Senator Rath said, that's why we really need our local municipalities to look into it, to know where are the good areas, the good locations, so that they are on places that are on bus runs, that do have access, if necessary, to transportation for people who are disabled. Because I know that I apologize, I don't remember which of the legislators mentioned having problems getting one of their constituents into affordable housing. And I think they mentioned 14, couldn't find something less than $1,400 a month. And I apologize for not remembering who mentioned that. But you would find that out in our areas, it is much less expensive to live. Out here, it's not that hard to rent an entire house for less than $1,000 for an entire house. So, those are just factors that come into play, but I do think we can't overlook overall the transportation aspect. Thank you.
That's a great point. $1,000 for a house? Oh my God.
Or less. I know people who rent houses for $700 or $800 a month, an entire house.
Fair enough. I want to take a little bit of time for a lightning round of audience questions because some of them are pretty good. Let's just see who might know a thing or two about this. We were talking about local control a little bit ago, I think Senator Rath. One already vaccinated senior would like to know when senior centers are going to open up. She wants to hang out with her friends. Anybody hearing anything from the governor's office on this one?
We have not. I think as all of us, we follow the trends of the rates in the community across the state of New York, and our hope is that once the vaccinations continue, that the senior centers will open up. And I don't want to deviate from when senior centers are opening up, but the whole vaccination process in New York, I think, it definitely is moving forward. The governor has pop-up sites all across the state. He's targeting some areas of communities of color, which is good. There's one thing that we think is missing, though, in the governor's plan, and we've asked him to do something about it, is the homebound vaccination plan. AARP's heard from the homebound. We've reached out to organizations, and there isn't a statewide central plan to vaccinate the homebound, and we think it's very much needed. As we all know, which is great, 16-year-olds and up can get vaccinated now, which is great. The college kids are getting vaccinated before they come home from school. But that one piece in AARP's opinion is missing that really needs to be developed. And we're really hoping the governor's office puts together a plan to do that. It's just something that it just has to be done. We cannot leave that population out. And that population is 50 plus, it's younger, it's older. So we just can't leave it out.
We've heard. I was just going to say that
that was an issue that, and I think actually I was on a few Zooms with Ms. Clark about it, where it was talked about from the very, very beginning that that this group of in-home elderly was overlooked. And I'm sure many of us, I know I did, contacted the governor's office, and they said they recognized it as a problem and they would look into it and get back to us. And I've never heard another word about it. I have a 95-year-old neighbor that I drove all the way down to Wayland so that she could get vaccinated. And I know that my fellow legislators have done similar things. And we've been on the Zooms with the nurses, and they've expressed their own frustrations along with us about this as being an issue. Ms. Clark, I think you were on that Zoom with me.
Yes, and I mean, I think one of the biggest issues right now is the Johnson & Johnson pause. The one vaccine was really the key to getting to the homebound families and folks who were really struggling to get out. So I think we're going to have to sort of see where that parses out. I know with the similar problems in Europe, the issues they were having with AstraZeneca really was a younger population. So many countries are still continuing to give it to seniors. So I don't know what will happen with Johnson & Johnson. I think that's really, really important to stay on top of. And I know I've been asking a lot. The one thing I do want to say, though, as we are seeing spikes again a little bit with COVID positive, is we're not seeing it in our senior population because we did a full out effort on some vaccinations, particularly in congregate care and other places, which I think has really changed the way then that we're seeing the spikes now, which are in younger folks. But I think even if we can't get past Johnson & Johnson, we have to figure out a way to use our EMS system, our home visiting nurse system, and everything to get into homes and make sure we're vaccinating people.
Yeah, I do want to say that Monroe County, and I know that this doesn't help, I have the great privilege of being housed entirely in one county, which makes my job a little bit easier sometimes, was formulating a mobile plan, but it's not even just the one shot with Johnson & Johnson, it was the fact that it could be stored at regular refrigerator temperatures. And that is an enormous technological issue that prevents a lot of mobile vaccination.
Right. The Pfizer and Moderna ones are stuck in the pizza boxes that can
Yeah.
only hold up for maybe a day or two, maybe 72 hours. So we got another good fun question. This is kind of ripping a little bit off what Assemblymember Byrnes was talking about with transportation. I remember before the pandemic, there were some exciting things going on with transit in Rochester, kind of this idea of, we'll call them like autonomous buses, kind of like Uber buses that will take you to places you actually want to go, not to like a bus stop where you got to walk a mile to whatever. I have no idea what's happened since then. Does anyone know kind of what's the status of that really exciting idea? Someone was asking, basically, what do we do for people who don't have, their own vehicles?
Yeah, I can touch upon that. So I think you're referring to, Zach, as the Reimagine RTS.
Yes.
And that went underway. And I want to give a lot of kudos to Bill Carpenter, Tom Braid, and that whole team, who spent years talking with local governments as well as community groups and employers to kind of connect the two. And I think Assemblywoman Byrnes talked about the access to transportation in some of our more rural areas. I go all the way up the lakeshore to Clarkson and Hamlin, right? And so again, also transportation areas or barriers to get to those communities and villages as well. I will say, to your point, Zach, one of the things I liked the most about the Reimagine RTS plan was the first and last mile conversation. So it wasn't that we have to have buses, whether they're the new electric buses or not, go every place, but it was, we have to get you to critical locations where you can then access, take advantage of the infrastructure we already have, whether it's ride sharing like Uber and Lyft, to go that last mile to an employer, to a senior center, to a grocery store, what have you. And so we don't need these giant buses going all over Monroe County, or really the greater Rochester region as a whole, because they're inefficient, they're slow, they pollute a lot, and we can find ways to move more people and get the people to where they actually are trying to go to. And one of the things that, especially as we have an aging workforce population, by the way, not everyone who is 65 retires and walks away. We still have a lot of folks who are still working at that age. So as we have an aging workforce, finding ways to connect people from their homes to their employer, because we know most of the jobs that are being created in the Greater Rochester area are actually not in our downtown, but are actually in our suburban towns and in more rural areas. One of them is actually out in Senator Rath's district in Genesee County with the STAMP project. So, I think that transportation is going to play a critical role economically and socially. I cannot underestimate or emphasize, the point of socialization. So whether you're socializing in a senior center, in a community school, or space where the community is coming together, or whether in a workplace environment, folks need to see each other. And this was really at one of the heart of the nursing home issues that we've talked about in the very beginning of our time together, which is that social isolation that took place for all those many months during COVID of our loved ones who were unable to connect and have that human touch. And so we need to, as we build transit systems, and I'm very proud, by the way, of our investment in upstate transit. I know Senator Rath and I share that belief, certainly on the Senate side, of the investments that were made in terms of the STOA dollars and the CHIPS money that was invested, millions, hundreds of millions of dollars that was put back into upstate New York transit systems. So I do think that now that we're hopefully getting to a better place, we need to have that conversation about what is this reimagined RTS plan and how do we implement it fully so that our aging population can take advantage of the technology.
Senator Cooney is absolutely talking my language when it comes to investment in our roads and our bridges and our infrastructure, critically important. But one of the things we need to talk about when it comes to this issue is the route utilization and the route optimization when it comes to our transportation services. And it's been long, hard looks, I know, with the reimagined RTS, as well as the NFTA here in Erie County, as well as Genesee County Transportation, because there's ways in which you can have transportation systems, and there's ways in which you can make sure that they are structured and functioning properly. And I think that's always going to be a very organic local project and a local look at how you can make it work. But another very important point when it comes to transportation is making sure that we are partnering with many private sector transportation organizations that many times fill the gaps when it comes to transportation needs for our seniors. If it's transportation for access to a doctor, transportation for access to a pharmacy, or if it's work, whatever it is, we should always make sure we're paying very close attention to some great private sector transportation and transit organizations across Monroe County and everywhere else, because they're gap fillers. So it's not just our regional transportation companies, but it's also some of these other wonderful companies. And our seniors, I know, are always struggling with transportation. It's a huge priority of mine. And with all the money, the millions that we spent on CHIPS and Pave New York and extreme winter recovery and all the rest, the roads are going to be smoother. So they're going to be easier to travel on throughout whatever means we have to get to where we need to go. So this is a huge priority for mine, that's for sure.
I happen to be
we're almost out of time, unfortunately, but
I just have an actual answer. I was on the call with RTS yesterday. It's like rolling out in a month. I just wanted to say, like, I actually know the answer to the question.
Breaking news. There we go. I'll take that. And Assemblymember Lunsford has highlighted a very important point. I'll call it the final challenge of the event. Can a state legislator give an answer in about 30 seconds? Because we do have, I think, 6 or 7 of you, and we're running out of time. I would love for each of you to just take 30 seconds, hopefully, but definitely no more than a minute, or we're going to run out of time, to just highlight one takeaway for our audience on what's happening in the Finger Lakes region when it comes to helping seniors. Maybe we'll start with you, Assemblymember Clark. One takeaway for our audience today.
One takeaway, we're gonna make the ombudsman program better, and we're going to strengthen the volunteer corps that takes part in it, and we've got more money for it for the first time ever, and we're going to do a much better job of making sure that when our ombudsmans are active and working in our nursing homes and long-term care facilities, that they're actually also getting answers from state agencies on complaints. So yay!
That was perfectly timed. Senator Rath?
I think the takeaway is that the needs of our seniors are being heard and the needs of our seniors are being prioritized. And each and every one of us who is on this call pays very close attention to the transportation concerns, the debt concerns, the housing concerns, the quality of care that's in our senior facilities. We've accomplished a lot of that within this budget. It continues to evolve, it continues to change. And as successful state senators and state assemblymen, we need to change with the times. So we're all here working with you all, listening, and help is on the way, I probably would say is the best takeaway.
Assemblymember Lunsford?
I actually am going to leave this event and go straight to Food Link. So I'm going to talk about the way we are dealing with food insecurity in our seniors. We had a huge investment in Nourish New York, which is helping not just our seniors, but our farms and making sure that we're getting fresh food to people who need it. So I'm really proud of the focus that we put on this budget on feeding our seniors.
Senator Cooney?
One area that we didn't touch upon, but I do want to make a mention of it, is our dementia population, our Alzheimer's population. My mother suffered from frontotemporal dementia. I was her caretaker for a number of years. And so one thing that the takeaway is we have not forgotten about those who are having trouble with their memory. And we know that all of these issues, transit, housing, food assistance, long-term care, are made more complicated when you have a cognitive inability. And so we're investing the resources necessary with the Alzheimer's Association, and we know we have more work to do in this space.
And Assemblymember Byrnes.
Thank you. There's a lot of takeaways. I guess I would just summarize it with the fact that there are organizations like AARP and others who specifically advocate day and night for all of the issues concerning seniors. I mean, we've only touched on some of them today, and we've touched on a lot. So the fact that you are willing to advocate, have these functions so that we can talk, you find out the needs, the information, and spread it so that your advocacy can be put into action, not just words, but action. And so what I take away is that your organization, having these types of events, providing us with the information and the dialogue we need, empowers us to go forward and address the issues. Some of them may or may not be relevant in our own districts, but they're all relevant to the citizens of our state. Thank you, sir.
And batting cleanup, of course, is Bill Ferris. Your organization represents a very diverse membership across the state. What's one final takeaway that we should keep in mind about how best to help them?
Well, one takeaway is that AARP represents the 50 plus in New York. And with, I think there's 24 or 26 legislative days left on the calendar. And just two issues that we're going to push very hard on is a pay to delay bill where drug manufacturers have agreements with generic manufacturers of drugs to keep their drugs off the market. We think that's a bad idea. We want to ban that practice in New York like California has. And also retirement security. We talk about people living in the community as long as possible. And we need money. Everybody knows we need money, whether you're young, old, 50, 60, you always need money, and you need money in retirement. And we're looking at a retirement security bill by Assemblyman Rodriguez and Senator Savino, and the pay to delay bill is Senator Biagi's bill. So though RX affordability and retirement security are high on AARP's list. And Assemblywoman Clark, we love the long-term care ombudsman program as well. So we look forward to working with you on that.
Well, that was a great note to leave on. Thank you to all of our panelists. I really would like to recognize an amazing thing that just happened here. We just talked about state politics, New York state politics for an hour, and the words Republican and Democrat did not come up a single time. So, obviously these are issues that transcend a lot of the normal partisan divisions. I just want to thank you all for a very fruitful and informative discussion. It's nice not to just have a food fight like we see so often on TV. And of course, we could not have done any of this without the great AARP, which helped us, which sponsored this event, and helped us put it on. And let's keep the conversation going. We're going to have more of these legislative forums. You can join us on April 22nd for our latest coronavirus update, which is focused on safety, particularly with an emphasis in New York City. We'll have a bunch of folks from the mayor's office there. On April 23rd is our next AARP webinar with all those people from the Hudson Valley. I think we've heard of that place, who are facing a lot of the same issues as Rochester. Whether or not they're downstate or upstate, we'll leave that for another day. And then on April 28th, we're recognizing a real a population that we don't nearly focus enough on, the nonprofit sector. We're going to be having our sister publication, New York Nonprofit Media's 40 Under 40 event with all sorts of notables from the nonprofit industry attending. Again, thank you all. Thank you to the AARP and our great audience. And I'm Zach Williams, City and State. Follow my newsletter, comes out every day at 2 p.m. You can sign up at cityandstateny.com to find out the latest going on in Albany with all these state senators and members of the assembly. So thanks again. We'll catch you next time.